Hey there, it's Steven back on the YouTube channel. I yet again have a guest today. And if you haven't seen any of our other videos, you know I never, ever, 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 ever introduce my guest because I can mispronounce names or forget something in a job title or description. So I always hand the mic over to our guest. So if you could just tell us your name and what you do and just a little bit about it and yourself, that'd be great. And we'll get started.
Awesome. Thanks, Steven. So my name's Wayne Bohman. I'm the nice insurance guy. I work through the Bullock agency based out of Logan. I do Medicare, ACA, and life insurance policies. And I've been licensed for coming on 6 years now in the health insurance and life insurance field. My main focus is really getting in and helping people understand their plans, for example, and what's available for them. For example, on the Medicare side, just in my zip code in Cottonwood Heights, there are over 46 plans that are available. And for someone jumping on for the first time, that might be a little overwhelming. So, what I like to do is go in and kind of sit down, spend some time, figure out what their needs are, help them answer some questions to help me guide me in helping select, presenting a couple of plans that would fit their needs, including, their doctor's medications and other things that are important to them based on the plans.
So when it comes to insurance, I think most people, of course, deal with car insurance because it's the law. They sometimes get into life insurance, but of course, health insurance is the big, big thing that, again, is universal like car insurance. And we've seen so much of the health insurance field change in the past 15, 20 years because of government legislation. Why don't you talk a little bit about some of the things you do with health insurance and maybe you share a helpful tip?
Awesome. Yeah, great question. So, how it's changed over a lot is really the ACA marketplace, more commonly known as Obamacare, came into place, affecting those under 65 and those on Medicaid. So, if you're in between under 65 and on Medicaid and don't have insurance to work, you can get that. And it's basically means that there's no underwriting, meaning there's no questions. You could have issues and they have to accept you, which really opened a lot of doors for people, but it also created a lot more plans and issues where you've got to make sure your doctors are network and your medications are covered and specialists and all those things. In fact, on the ACA side, there's 81 plans in my zip code of for Cottonwood Heights. And so what I do, whether it's they're under 65, over 65, is I sit down and really kind of make sure they understand what their plan entails and what they're going to need to make sure they get the best coverage. Because the last thing you want is to go into a doctor and find out like, oh, you're not in network or this isn't covered. And so my focus as I'm going in is really trying to make sure they understand how to use their plan because each plan has different things that are beneficial, more so on the Medicare side than on ACA side. But even then, there's some things, some cover mental health a little bit better, some cover physical therapy or chiropractic a little bit better. So it's really getting to know the client, finding out what their needs are, where they want to go to be seen so they don't have to switch doctors, and then helping them sign up for a plan and then helping them make sure and being available for if they have questions.
So with affordable health care, the marketplace, and then Medicare, is Medicare on the healthcare marketplace or is that totally separate?
It's separate. You can still, I mean, they both plans you could as just a person, if you're like, I don't want to deal with an agent, you could get on and sign up for your own by yourself. There is no cost for me to help you. So if I came in and helped you sign up, there's no cost. Whichever company you decided to go with, they would be the ones that would pay me, or I'd get compensated, however you want to look at it. But the nice thing about having
Yeah.
one is if there's questions. So if you have a question, you don't have to necessarily go get on the 800 call line and wait for, depending on the carrier, 15, 20, 30 minutes to get an answer. You can call me or your agent and say, hey, I I have this question or this particular thing wasn't covered, or I'm being billed this amount or whatever else is going on. And then I can, if I don't know why or the answer, then I can call a special line as an agent and talk to someone usually quicker. Or because it's my job to support you, I can be the one that waits online and then say, hey, I'll call you when I've got them, or I'll find the answer and then I'll let you know. So there's benefits to having an agent, especially one that's going to, spend the time with you. So that's kind of where I'm trying to be is that asset for everybody that I talk to.
So, yeah, it's funny because I mean, I was at one point in time on Marketplace, and yeah, I tried it by myself, couldn't, and I had an agent, and it was very helpful. I know I always tell the story about whenever we had our first child and tried to add her on, the system would not work, and we had to sit on the phone, and my agent did it with me because they wouldn't just talk to me, and they were convinced that somehow my newborn was much older, and, they go through all the standard questions. Does she smoke? What is her job? There's so many different variables and options in the plans, plus you have, and I'm not afraid to say this out loud, you have this big beast of the government that is very bureaucratic and it's hard to manage. I mean, it's very difficult to manage. So I imagine those parallels in the marketplace have got to parallel within Medicare when it comes to understanding the plans and navigating for people. What would you say is the difference between the marketplace and Medicare when it comes to you helping clients?
There's not a lot of difference. There's more, I guess, perks in Medicare, more specialized plans. For example, there's plans for people that are on VA benefits. So, certain VA benefits. There's plans for people that have diabetes. There's plans for people that have certain chronic illnesses. That's one of the differences. Helping find out if they qualify for that because there's some extra perks that help give them some extra benefits. A lot of them also have over the counter benefits where they get, amount loaded into their car. And what I found the biggest thing I'm finding is I'm talking to people that already have Medicare is a lot of them don't know that was even part of their perk. Now, having signed up for things and forgotten about perks, there a lot of things could be that they just forgot because they didn't use it, or they maybe their agent didn't tell them, didn't think it was that big of a deal, or briefly mentioned it, or things like that. So it's really kind of going in and finding out, even if they're not my client, let's say they're on the best plan for them, they're happy with their plan, or maybe even they're happy with their agent. It's not, I'm not going and trying to steal anybody from them, but I might go in and say, hey, are you using these benefits? Are you aware that this plan has those benefits? And then being able to help them kind of see maybe some spots where they can get a little more perks for what they're paying for or what their plan covers.
Yeah, and one of the things you said in there I thought was really interesting. You talk about like there's different plans, there's different perks based on like basically their needs, level of care, their health. What are some of the misconceptions people have with Medicare? Because I imagine the what I call the general public, so people who are not, senior professionals like I, what are some of their misconceptions about Medicare and what it provides? Like let's break some myths, like
I,
what have you on the.
I think a couple 'cause there's 2 types of Medicare. Well, there's 3. There's original Medicare, which is A, B, and really you'd have to add D in there, you get the penalty. So that's gives you some pretty good coverage, but there's no max out of pocket. So I've talked to a lot of people like, "Oh, I've got basic Medicare A, B, and D, and I'm covered and I'm good." The issue is as long as you're healthy, yeah, that's good because you're not paying a whole lot, extra, I should say, than what you have to do for the A, B, and D. But the other misconception is there's 2 types. There's a Medicare supplement plan, which has a monthly premium, and then most I don't even want to use the word most, but a lot of the stuff is covered. So little to no out of pocket while you're using it. When then there's the Medicare Advantage plans, which have typically lower premiums, but you're paying the copay co-insurance. That's more like typical insurance. And there's people that drink the Kool-Aid from either side. There's some people that only sell the supplement plans and, "Oh, this is the best." And there's people that only sell the Advantage plans thinking, "Oh, this is the best." And I think that's probably the biggest myth is that there isn't one best universal best plan, even within the carriers. You want to spend that time with them to kind of say, okay, what are your concerns? Where are you concerned? Are you concerned about your monthly out of pocket or if something major happens? Or do you have health issues currently? Do you, where are your concerns in the future? How is your utilization of your current health insurance? And by being able to get that, you can kind of get into which plan is the best for them. But I think too many agents or people think or even told because I've ran into it, it's like, oh, I'm on the best plan. And you start looking at like, well, you're paying this much money with this plan, you would pay less and it would same coverage or different things. So, or same thing with certain providers. Oh, not to mention A, but oh, such and such is the best provider. I love that, that their network and yet their doctors that they go to maybe not might not be in that network. So it's kind of I guess the biggest miss are just that one particular provider or type of plan is best for everybody when it's really individual.
Yeah, it's really interesting because I honestly I don't know a ton about insurance. I wish I knew more. I really do. I I've started to learn just as you get older, you kind of use insurance more and more
Yeah.
because your health. I mean, like I said, I used to be on the marketplace, then switched to private pay just because it was mostly a business and tax decision is why I made that decision. Would you say in your business there's a particular type of insurance you like to help people get the most? Maybe that's a weird question, but I'm just kind of curious.
Yeah, it's a little different, but this may be that you're looking for, but I like to help them get the one that's best for them.
Yeah,
Because
no,
again,
I think that's
each person's individual has different needs. There's not a one size fits all thing. I mean, there's some generic ones that are, like on some of those specialty plans, not all providers have them, but
oh,
it's kind of geared. But yeah,
yeah,
it's just trying to make sure.
I think I may have asked this incorrectly. So you do more than health insurance, right? Or did
Right.
I misunderstand that?
No, more
Yeah.
than that.
Yeah, do you I mean, I guess the question I was getting more general, so I kinda switched the topic. Whoops. Sorry, folks. Uh, like, would you say that you prefer working with people getting health insurance or life insurance or another type of insurance? That's the question I meant,
Well,
but maybe your answer still
gotcha.
the same. I just asked it well.
It's each one has its unique challenges and kind of fun things to do. I like working with the Medicare age. I don't know why, maybe I'm an old soul, but I like that because I just, sometimes I feel like just sitting down and talking, getting them talking and letting them kind of have a friend. Some people don't have a lot of visitors, so that's kind of fun. I like the life insurance side because so many people are underinsured in that way. And so I just like where I can step in and find a need and help, find a kind of a pain point of like, oh my gosh, I've got a family of five. We just started our own company. We don't have insurance, and helping them kind of figure out the best way to do it, utilizing, the ACA plan, utilizing their income amounts and going through the charts and finding out where they fit within that to get them the best price possible. Or same thing with Medicare, finding out if there are a specialty plan, are they on Medicare or Medicaid? Do they need extra help? Are there things that I can do to help alleviate that pain? I think that's where I get the most joy out of it is when I find that plan, I'm able to kind of get someone on a different plan or the right one where there's like, oh my gosh, this is going to be helpful. This is going to really help us kind of survive for the time being while we're transitioning, getting more money with their business or moving into that Medicare retirement fixed income stage.
That's great. What would you say is something that makes you different than another insurance agent or broker that can help with essentially seniors and with the Medicare and all those choices? What makes you a little bit different, you think?
I think it's being willing to take the time to explain and answer the questions and really kind of make sure they're on the right plan and also being there in the background. I'm not afraid of the specialty ones. I've talked to some agents that won't touch the Medicare Medicaid sphere, where there's some great benefits for that population. I will help whoever needs help. And also I've also had some people that have access to plans through their work and kind of help them understand what they're getting to make sure they're getting the best plan for their needs there, even though there's nothing that, everything that they're getting through work would be typically a better cost than what I offer. So I think it's just not worrying about so much the cost of or what I'm making, but just really trying to make sure that they're getting the best plan and getting the support they need to utilize it.
That's great. I'm curious if you had any other thoughts before we wrapped up our YouTube one-on-one today. If you had any other thoughts when it came to your business, Medicare, or just wanted to revisit any points you made.
I think it's just if you don't have access, if you don't like your agent or don't have an agent and have questions, reach out. Happy to answer questions. Or if you're like, well, I'm not in Utah or wherever, I don't know how big this goes, but I am licensed in Utah, Idaho, and Wyoming. If you're in any of those states, find an agent that's going to sit down with you and spend some time and really answer your question. I feel like that's what we're here for. If you find a good agent, they're going to be there to help answer your questions. They're going to have the support they need. And that is a nice thing about where I'm at within, branding myself as the nice insurance guy. But through the Bullock agency, I have great resources up there that if I have questions, because insurance is a huge field, there's so much to know and learn that I can call and reach out and find the answers fairly quickly, if not in the moment, to make sure that as a client is taken care of.
I think that's great. How do people reach out to you?
My cell would probably best, 801-336-0564. I'm also on Facebook as the Nice Insurance Guy or Wayne, the Nice Insurance Guy Bowman. Might be just be Wayne, Nice Insurance Guy Bowman. But yeah, you can find me there and message me, DM me there, or just shoot me a text or give me a call. So
Yeah. The Facebook page, and then of course y'all got the number. Of course, we'll have that in the transcript. We'll put it in the description box below so people can reach out to you. And when this is all said and done, everyone's going to be watching it. So if you have any comments or questions for Wayne, please leave them below. Please feel free to like, share, and subscribe, of course, because we're trying to grow this channel. I think in the past 18 months, it went from 3 subscribers to where we're almost at 200. It takes a bit. It
yeah,
takes a bit for YouTube, that kind of traction, a lot of content. Thanks so much for being here. I really
thanks
do
for having me.
appreciate it. Folks, thanks for watching, and we'll see you next time.
Yeah,
Bye.
thank you.